facelift or something easier like fillers and Botox, we can camouflage the signs of aging. But even when the face is tight, other parts of the body will let you know that something ain't right. Like our hands, for example.
My hands look like my grandmother's. In the summer, especially when I'm out in the sun too much, they get very dry. My mom has started complaining about her hands and how they're getting sunspots from being out in the sun too much.
I don't like that the brown spots on my hands that used to look like tiny freckles now are darker and larger and make me want to wear gloves.
I just don't like the way my hands are aging. I'm in my early 30s and this is just not really good because everybody sees your age right here.
Well, here to help us turn back the hands of time, get it? From the Institute of Anti-Aging, welcome Dr. Richard Laconi and Clinic Director Dana Laconi and their patient Erin Hayter. Hello. All right, we do forget about, we focus mostly on the face and we forget about other things that give away our signs of age.
Yeah, absolutely. Even when people are young, they start to protect their face. They use the sunscreen, they use the hat. But frequently, 10, 15 years later, they kind of look in the mirror and they go, what happened to this? So they kind of forgot about those areas.
Yeah, we're not in the 1940s where we used to wear gloves and things.
some of them are very vulnerable because the skin is really not that well adapted to environmental stress like sun.
Yeah. All right. So dry, cracking skin is kind of one of those signs that your hands might be overexposed.
Absolutely. Yes, it's again, the sunlight's probably the number one, and then just the intrinsic factors of aging. You know, you could lose volume, lose collagen.
Yeah.
So it just kind of
keeps going. All right, yeah. Then the brown spots, age spots, and then, of course, loss of volume. There are several celebrities who we always talk about their bodies are so fit and they look so great. Sarah Jessica Parker is one, and Madonna, but you see their hands and you go, oh, wait a minute now. We've seen the close-ups of their hands have been in several magazine articles, and they said their hands actually look much older than their faces do. There's ways that we have of taking care of some of those problems. And one of those things is, of course, just getting those brown spots off of those hands. Is it the Photofacial that we talk about, Dana?
The Photofacial, the YAG, we have the Active FX. So we have different lasers for different problems, but the Active Deep FX actually helps tighten the skin, and the Photofacial helps remove the brown spots.
All right. So, Erin, what problems were you having with your hands that you just weren't liking?
So my veins are really popping out as I'm getting older. I feel like the volume in my hands has gone away, so I'd like to see if we can make my hands just look a little fuller so that
okay, and there's a way to do that. But there are different reasons why sometimes people's veins might pop out. Madonna and Sarah Jessica Parker are so skinny that they're very vascular, and you see all that. I know I don't like him either. But anyway, no, I'm just joking. But and then other times it's just that skin starts to thin more.
Yes, you know, it's just part of the intrinsic aging. You lose a little bit of that subcutaneous tissue, that padding between the tendons and the veins, so they tend to show more. Loss of weight, you know, generally it's a good thing to lose a pound or two, but sometimes one of the consequences is you can start to lose some of that sub-Q body fat that kind of padded all those. So then it starts to show up a little more. You can see the tendons, you can see the veins. So you can kind of have your cake and eat it too. You can lose weight, but you don't have to have all the gnarly looking hands, you know.
The gnarly hands.
You know.
It's funny, that fat battle that we have, we either want it or we don't want it. We just want it to in the right places, right?
Right.
Okay, so we look at Juvederm and all the types of fillers and things, Dana, oftentimes to put in our face to take care of, you know, deep lines and the whole bit. But a lot of us haven't thought about using it actually in the hands.
Oh, it's great for the hands because it just adds volume, adds youth back to your hands. You can tell a woman's age by her hands, and a lot of us forget to take care of our hands like we do our face.
Right.
So we're using the Juvederm to restore
volume.
volume.
Put some in there, right there. And then so you put that in, and then how long does something like that last?
This can last up to a year and a half or so.
Wow.
And yes, it's great technique. It's actually quite simple, really. The technique is not even sophisticated.
Yeah, I was going to ask Erin. I was going to say,
no, I can't even feel it.
Yeah, and so basically, hyaluronan, you know, the material that we're using here is part of the natural body's filler, you know. So even though we call it dermal filler, it's what your body uses for dermal filler.
Yeah.
It's called hyaluronan. And
you see the effects, it looks like, almost right away.
You see the effects right away. It's one of those great what you see is what you get, instant gratification deals, you know. We all love those.
This is a lunch hour moment.
It's a lunch hour moment, yeah. Basically, all you do, we just inject it between the little tendons there where you can see the little hollow areas, and then you just kind of move it, or, you know, you just kind of rub it in. And,
yeah, can you lift your
stays
hand
there.
up there just so we can see the, yeah, like that. Let's see
that.
there. All right, and then it goes in, and then Dana, you kind of smooth it out a little
massage
bit.
it in. So just
distribute it
restoring
around between
volume.
there.
Yeah, yeah.
Just like we do our lips and our cheeks and our smile lines and our frown lines.
And we talked about the Photofacial to get rid of the brown spots and stuff, and I just want to touch on
Photofacial's awesome,
yeah,
too, yeah.
a couple of other areas that kind of show our age that we forget about. The neck is one, and of course the décolleté can get those spots and things too.
Right. If anything, you know, you'll see people who've been taking care of their face all these years, and they have nice-looking facial skin, no brown spots, you know, and then the décolleté just looks like a war zone, you know.
Yeah.
It's you know, there's red streaks and brown spots and thin skin and
the loose neck.
And also because this area is more vulnerable. Your skin on your face, we think of it as fragile, but the skin on your face is actually 3-4 times thicker than the skin here.
Okay, and that's the reason
So
why
it's
it kind
more
of goes,
durable.
Yeah.
It's meant for it.
I look at the before and afters on some of these hands right here, and just want to mention that you can use like your laser tightening in your neck to get a loose neck kind of tightened up, and then also the Photofacial on the chest to get rid of all those
Yeah, we use
brown
that in
spots as well.
Invasix right up in here, and it tightens the skin, tightens the sub-Q muscle.
All right, I'm going to call Madonna and Sarah Jessica Parker and tell them they need to come on down to Houston. You'll take care of it for them. All right, this month there is a special for Great Day viewers, Botox for just $12 per unit, plus get $100 off Juvederm filler and $100 off a Photofacial treatment when you mention Great Day. For more information on any of the full range of beauty and anti-aging services available at the Institute of Anti-Aging, you can call them at 713-807-1000, 713-807-1000, or go to their website, antiageinstitute.com. Well, school is